Hello there, my name is Caroline Maughon, and the topic I have selected is the effect of the Affordable Care Act on women's health care, and more specifically, the change in out-of-pocket costs for prescription contraceptives. An overview of the topic is just that we're looking at the Affordable Care Act mandates for contraceptive methods for women without cost sharing, and we're asking what the impact this will have on out-of-pocket expenses for contraceptives, and whether or not that will affect the unintended pregnancy rate in the United States. This study covers the years of 2011, 12, and 13, looks at women aged 15 to 44 who have claims out for contraceptives, and we're looking at their out-of-pocket cost changes for the years 2011, 2012, and 2013. The graph above me is looking at the percentage of women on each form of contraceptive. As you can see, there are definitely a larger percentage of women, much larger in fact, on non-permanent contraceptives, which are, I'm about to list them for you, and you can see that almost 22% of women are on the oral contraceptives like birth control pills. The policy at hand is the Affordable Care Act again. On August 1st, 2012, the ACA mandated that health plans must cover FDA-approved contraceptive methods, including the list I just mentioned of oral contraceptive, injectables, rings, and more. These regulations were regulated to ensure women's health and well-being. This study is more of a comprehensive analysis on cost savings for most FDA-approved contraceptives for women insured under multiple commercial health plans from 2011 to 2013. The specific study I'm looking at is titled, Are Women Benefiting from the Affordable Care Act? A real-world evaluation of the impact of the Affordable Care Act on out-of-pocket costs for contraceptives, conducted by those you see in front of you. And like I just said, it's looking at the cost savings for most FDA-approved contraceptives among women for the following years. However, it is important to note that while the ACA was passed and phased in 2012, the provision for contraception actually didn't really go into effect until January of 2013, which is when the initiation of the new the new plan year began. The data used was found from the Truven Health Market Scan commercial claims database, and we're looking at women from 15 to 44 with any contraceptive usage and pharmacy and medical coverage in those years. What we did was women were placed into 3 separate cross-sectional study populations for those years, and we looked at the women in number of proportions with 1 or more claims for contraceptives to determine their out-of-pocket costs for each claim. Descriptive statistics were used to measure and describe contraceptive use, costs, and demographics of the study population, and these analyses were carried out using the SES 9.3 program. The table to my left is a demographic for the overall populations, and if you look at the total number of women from 15 to 44 years of age with contraceptive use, you can see that from 2012 to 2013, there was an increase by 0.7% in usage. Seems like a small number, but you have to keep in mind that it is in percentages of the population. So it is still a huge effect of women now having access to contraceptives. The results of the study was that, again, 22% of all women were on oral contraceptives, which is higher than the national average that was found the previous year, which was only 17%. The mean total annual out-of-pocket expenses decreased by 72% and for permanent contraceptives and by 68% for non-permanent. So you can see that gap was quite large for each of those throughout those years. Overall, the proportions of women using IUDs increased from 54% to 91%, which is a huge change and a much more effective method than oral contraceptives, so that's really good. As well as the proportions of women to receive injectables, implants, and IUDs increased, but it's a smaller proportion. The results of this large database claims analysis show that out-of-pocket costs of the FDA-approved contraceptives have decreased nearly 70% since the implementation of the ACA in January. We hope that this will lead to better family planning and also lower the risk of unintended pregnancies in the United States. The graph to my left is the total annual out-of-pocket cost for each form of contraceptive, and you can see that across the board between the years of 2012 and 2013, the prices dropped significantly. So overall, we're looking at the direct cost of unintended pregnancy estimation, and it's approximately $4.5 billion annually, which is approximately half of the pregnancies in the U.S. being unintended. The ACA has the potential to reduce this cost burden as well as eliminate disparities in reproductive health care. As of 2013, approximately 30% of women still have to share costs for contraceptives, so we need to work on getting that number down as well. Implementation of the ACA has greatly impacted the cost of FDA-approved contraceptives, but we still need to determine the elasticity of prescription contraceptives in relation to use and improved clinical outcomes in order to determine whether or not that 30% needs to be decreased further or not. Thank you guys for taking the time to watch my podcast.